Thank you, everyone. Good afternoon now. My name's Leanne. I'm a genetic counsellor that is based at Great Ormond Street Hospital in London. And I'm going to be talking to you today about the research that I did for my postgraduate dissertation at Cardiff University. And I just want to start by thanking Annabelle's Challenge, which is a vascular EDS charity based in the UK. And I did all of my recruitment through their charity. So just a bit of an overview about what we'll be speaking about today. I'm going to talk to you a bit about my research question and the literature review that I did to basically encourage this research, and then the aims and objectives of the study. And in order for me to explore the coping mechanisms used by individuals with vascular EDS, I wanted to highlight the lived experience of those with the condition. And so I'm therefore going to go through each of the themes that I identified, and that will hopefully kind of link that with the unexpected. So my research question was, what is the psychosocial impact of living with vascular Ehlers-Danlos syndrome? And I conducted a literature review which, from the very beginning, highlighted that there wasn't a lot of literature or any literature looking specifically at the psychosocial impact of living with vascular EDS. And Byers mentioned that it's something that is too often neglected. So when I conducted this literature review, I looked at other conditions that were quite similar, so things like long QT syndrome or hypertrophic cardiomyopathy. I also looked at the classic and hypermobile types of EDS, and some other studies on Marfan syndrome and Loeys-Dietz syndrome. And as you can see, these are some of the themes that were pulled from this literature review. So things like reproductive decision-making or working life and study, and communication. And these all kind of helped formulate my research aims and objectives. So I'll just give you a couple of seconds to have a look at those before I move slides. So my research aims and objectives, following on from the literature review, there was a lot of questions that we wanted to answer. There were a lot of areas that we wanted to look at specifically. And what I tried to focus on was what's on the slide here. So the day-to-day experiences of living with the condition, social life and the desire to socialize and how the condition impacted that, relationships with family and friends, the impact on work and study, and the perceptions of having a family or family planning. And lastly, we also wanted to look at the mental health impact of the condition as well. So these were my results. In total, I had 21 participants come forward that I interviewed. These participants were aged between 19 and 61 years old, so it's quite a good range. And they had either had predictive testing or diagnostic testing for vascular Ehlers-Danlos syndrome. And I used semi-structured interviews with all of these individuals and came up with these themes that you can see here. So physical limitations to daily life, risk perception and existential thoughts, communication and support, responsibility, loss, and then resilience and coping mechanisms. So starting off with physical limitations to daily life, every single participant commented on the impact of pain and fatigue on their day-to-day life. A lot of them spoke about the kind of tiredness of the condition and how that would affect them on a day-to-day basis. That then fed kind of nicely into the next sub-theme, which was time and energy management. So a lot of people spoke about allocating time and activities based on the energy that they had that day. And an example that one participant gave was, if she was going to clean the house on one day, that would mean that she was using up all the energy she had, and the rest of that day she wouldn't be able to do anything else. Engaging in social activities was quite interesting. A lot of participants commented on the physical pain and tiredness of the condition, limiting them to engage in social activities with family and friends. But alongside that, they also commented that they almost had to risk assess any social situation to make sure that it was going to be an environment that was supportive, or they were going to be able to get support if they needed it when they were there. Inability to carry out activities and tasks. This was something that, again, was across the board. A lot of participants felt a lot of frustration at not being able to do what they considered simple day-to-day things. Achievements and accomplishments. A lot of participants felt that the physical limitations of the condition had stopped them from achieving goals that they had initially wanted to do. So especially for those who were diagnosed kind of around adolescence, a lot of them had been playing sports before they got their diagnosis and then had to stop doing that. They'd planned to go to uni, and they felt that actually, as the condition worsened for them, they were unable to do those things and achieve those goals. And then lastly, intimacy was a sub-theme that kind of rose in the data. I didn't ask any questions about intimacy from the participants, but this was something that was brought up by quite a few. And a lot of them commented on the fact that, there was like this worry about it being intimate with partners and the fear that that might cause a rupture, but also how that had played out in their relationships as well. So moving on to risk perception and existential thoughts. So due to the variability in the presentation of vascular EDS, receiving a diagnosis actually elicited quite a few different responses. So some people were quite relieved, which is captured in this quote here, where someone says, when I found out, I was like, I knew there was something wrong, and I was relieved to have an answer. But on the flip side, some people felt that receiving a diagnosis actually elicited a lot of fear, and they felt that the condition was now something that they were thinking about every day and they were worrying about for kind of months and years to come. And then for others, they felt that they kind of looked back on whether or not receiving a diagnosis was helpful, and some of them regretted finding out that they had the condition or having a kind of classified diagnosis, because they felt, especially those that were diagnosed later in life, they felt they'd lived their whole lives without knowing and were able to make decisions freely, and now they were in a position where they knew about the condition and that was impacting them every day. Facing mortality, the uncertainty of living with vascular EDS, this was a really interesting topic that came up. A lot of participants spoke about kind of every day facing the reality of their lives and what that would look like. And I think this quote captures it quite nicely. Someone said, with us, we don't know whether we have 6 months, 6 years, or 20 years. And that uncertainty was really difficult for a lot of participants to kind of cope with. The future and growing old. So a lot of participants spoke about getting a balance. So planning for the future, thinking about a big holiday in a couple of years, but also recognizing that should they wait a couple of years? Should they book that holiday now? And this quote here that says, you also want to live in the moment. There was this kind of conflict of when is the right time to do these things? Should they be rushing them, or should they still just take their time? What if a life without vascular EDS? This kind of ties back into what I was saying before about achievements and accomplishments. A lot of participants felt that the condition had probably affected most of the decisions they'd made throughout their lives, and that impacted how they viewed themselves kind of moving forwards. Participants commented on feeling different to others, and this idea of vascular EDS being an invisible condition and people not understanding something that they can't see. And then lastly, living cautiously. So a lot of participants commented on feeling like a ticking time bomb, and you don't know when the next rupture is going to happen. Next, we have communication and support. This was something that seemed to be a vital component for participants, whether that was discussing the diagnosis with their friends, whether it was discussing the diagnosis within the family unit. There was a lot of conversations about how much do you share? Are you burdening others by telling them about your diagnosis or telling them about your next medical appointments? And vascular EDS support groups was quite interesting. So as I said, I recruited through the charity, and everybody commented that they had found that space really helpful to have that support group in that environment. But the balance that they tried to strike was that the more they became involved with the community, the harder it then was if someone was to sadly pass away from the condition, and that it felt that they brought their reality back to them as well. When to tell and how to tell was a really interesting topic that came up. When do you tell someone that you have the condition? When do you tell friends that you just meet? When is the right time to share that information with them? And actually, a lot of people commented on when is the right time to tell a partner that you're dating? When do you introduce that topic? When does that discussion come up? For thinking about barriers in relationships, a lot of participants felt that they wanted to communicate with their partners and found that really supportive, but they also didn't want to share too much because they recognized that whilst they were dealing with what they were dealing with, their partners were also kind of trying to support them through that and also had their own worries alongside that. The differences within the vascular EDS community, this was something that quite a few participants commented on. Some people saw the support group in the space, as I said before, a sense of community, somewhere where they could share their thoughts, where they felt supported by others. But some individuals found that if they were just trying to get through their day-to-day, then being part of the community sometimes felt that, if someone wasn't having a good day and they were sharing that in the group, that those negative kind of thoughts and their sharings impacted them on their day-to-day as well. And then lastly, this is something that every single participant commented on, was a lack of faith in healthcare professionals. They felt that they were never listened to, they weren't heard, and that really impacted how the condition was with them every day. Next, we have responsibility. So there was a kind of profound sense of responsibility throughout the interviews in different forms. So I've summarised them here. So the first one was concern for future generations. Now, a lot of the participants that I spoke to were not the only person in their family to have the condition. So it may have been that their parents had it and they had children that had it. And there was a lot of discussion about, wanting to be there for their children, to advocate for them and their care if they were also affected. And this quote here really summarises that. Someone said, if it happens to me first, I'm not there to protect them and to look after them. Personal health and management. One participant commented that you must become the master of vascular EDS because you're in spaces where people are not listening and you need to really advocate for your health so that you are cared for properly. Career progression was another interesting topic that came up. People commented on feeling guilty for not working or for the fact that the condition had stopped them from doing things that they wanted to do. And one participant said that they felt that the condition had defeated them because they hadn't gone on to achieve the goals that they wanted to. Raising awareness was really interesting, and this was something that a lot of the participants that were diagnosed later in life felt a kind of responsibility to do. So they commented that, they felt they had a responsibility to share their experiences with the younger people in the vascular EDS community so that they were able to have hope and see what a future could look like with the condition. And then lastly, financial uncertainty was quite an interesting topic, which kind of answered the big questions. Should I be paying into a pension? If we're going back to the uncertainty of the condition, what does that look like? And people kind of commented on, chances are I won't be here to draw a pension, but then on the flip side, they recognise that people with vascular EDS are living longer, and therefore, is it irresponsible to not be putting into a pension and to be living and spending their money as they are now? And then lastly, we have loss. So every single participant had experienced some level of loss throughout their diagnosis, and there were different factors that influenced that. So the first one was a loss of identity, and this was clear amongst every single person that I interviewed. A lot of them spoke about having to adjust. So even if that diagnosis was something that they were given at a young age, or if they were given that diagnosis later in life, adjusting to that diagnosis felt that they were losing a part of who they were. The next is social freedom and independence. So for a lot of participants, the condition directly affected their ability to do things day to day. And the kind of loss of that independence really impacted them because they felt that they were losing a part of who they were as a result of the condition. Choices around pregnancy and having a family, I've split this into kind of two areas. And the first one is the anticipated loss. So this is something that was kind of seen amongst those who hadn't had children yet and were thinking about the fact that maybe they wouldn't go on to have a family and the loss, the grieving of not being able to have a family or what that would look like for them. And then on the flip side, I had retrospective thoughts from those who had been diagnosed with a condition after they'd had children, and they commented, that if they had known then what they knew now, maybe they wouldn't have decided to have children, which I thought was quite a big, profound thing to say, because they recognised that, number one, either their child was affected, but also number two, that they had the condition and they may not be there for their children now in the future. And then lastly, the lasting impact of losing a family member to vascular EDS. So this theme really brought up about kind of participants looking at other people around them and using that as their goalpost to how their lives would look. So if they had lost a family member to vascular EDS at the age of 50, as they approached the age of 50, they felt very much that their time was coming to an end, and that had really impacted them through generations and also kind of influenced the discussions about health within the family as well. So I hope these themes have given you some context of the challenges that individuals with vascular EDS face. And now I'm going to talk about the coping mechanisms that individuals use to manage these. So resilience and coping mechanisms was a whole theme, and I thought I really wanted to pay attention or give some time to this. And these were the different sub-themes. So positive attitude and outlook on life, exercise as a coping mechanism, thought management and diagnosis, appreciation for life, and providing a voice to the unheard. So first up, a positive attitude and outlook on life. One thing that I noticed throughout every single interview that I did was the resilient nature of every single person. They recognized that the condition had given them several barriers and several challenges, but they didn't want to let that stop them. They were determined to keep going regardless of any setbacks that they were faced with. And this quote here summarizes that quite nicely. One person said, "We accept that we've got this condition and we make adaptations, and by making adaptations means you can still do these things, but we just have to be slightly creative in the way that we do them." I know we've had some discussions about exercise this morning. So exercise was also seen to be a really helpful coping mechanism for participants. From a physical health perspective, participants that did or were able to exercise commented on exercise being empowering and giving them this control over their bodies where the condition maybe hadn't. And so one participant said, going to the gym and things makes me feel better within myself. It makes me feel sort of healthier. And then on the other side of exercise, of physical health, we had the mental health impact. So out of the 21 participants that I interviewed, 14 of them commented on having mental health difficulties as a result of the diagnosis. And of that 14, 10 of them mentioned that they had sought out either CBT or counselling therapies to help them through their diagnosis. But what was really interesting was that of those people who were able to exercise, they felt that actually exercise really impacted and benefited their mental health. And I think this quote here summarises that perfectly. So someone said, it's good, I need exercise. If I didn't exercise, I know psychologically I'd be worse, and my body would be so weak, and that would make me feel worse psychologically as well. So I thought it was really interesting to kind of recognise the relationship between physical and mental well-being for patients with vascular EDS, because that came across as a really helpful coping mechanism for participants. Thought management and diagnosis. So when I was initially analysing this data, and when I was hearing of participants' experiences with the condition, and they spoke about compartmentalising vascular EDS and not thinking about it, and almost ignorance being bliss, I initially wondered if that was denial, if people were just choosing not to even think about it and get on with their day-to-day. But actually, as more and more participants kind of spoke about this, it became really clear that it was just a very helpful coping mechanism for them. They were very aware that they had the condition. They were very aware of the things that it limited them to do, but actually it felt a lot better for them to not spend their days thinking about it and to just get on with it. And so one participant said, I absolutely blank out my condition and completely pretend it doesn't exist. And for her, it felt that that was the way for her to get through each day without sitting there pondering on the condition. And another participant said, I'm quite happy to just put it in a box and not worry about it and not think about it, and that is my coping mechanism. Every participant was very appreciative and very grateful for the life that they lived. I think being part of the support group and seeing that, some people unfortunately didn't live as long as they had wanted to or had been a lot more severely affected by the condition made people a lot more grateful, and it helped them kind of see their own health in a more positive light. And so someone commented on feeling very lucky, and that helps them worry less subconsciously because they've seen how other people have been affected. And then lastly, providing a voice to the unheard. So this was a really interesting sub-theme that came out of the data. A lot of participants spoke about their frustration in regards to kind of being overlooked by healthcare professionals when it comes to research studies. And for many people, that was the driving factor in getting involved in this research because they felt that they hadn't had the opportunity to do that prior. So one thing that came up quite a lot was this condition comparison. So I think these two quotes really encapsulate what those participants were speaking of. One person said, if I was to say I had cancer, people would give you sympathy, a treatment plan. People would know what you're talking about, especially medical professionals. And another person said, I get slightly cross when I see all the funding for cancer research because I think they've had all this support and funding for years and there is nothing for what I have. And that was something that was really prevalent across most participants who spoke about research. And then the interview process itself really empowered participants. So a lot of them commented on signing up because they wanted to help advance science and knowledge of the condition. And this last quote I thought was really nice. One participant said that it's good to recognize how you feel and that they couldn't have had that conversation with someone they loved. And a lot of them felt that, as much as I wasn't there giving them therapy, it was a space for them to share their experience and also know that it was going to be used in a platform like this where their voices would be heard. So, to summarise, these are essentially the coping mechanisms that patients with vascular EDS have found helpful every day. Things like exercise, which was seen to benefit both physical and mental health, having a positive attitude and outlook on life, and this idea of not dwelling on it and just moving forwards. Thought management and diagnosis, so ignoring the condition actually seemed to be really beneficial for participants to help them get through each day and compartmentalising it and not it being the focus of their day. Appreciation for life, so practicing gratitude, comparing their circumstances with others, really helped participants cope with the condition. And lastly, providing a voice to the unheard. A lot of participants expressed that they wanted to have more opportunities for research. They wanted the opportunity to speak about the condition and how it was impacting them. And for those for parents who had children with the condition, they felt they wanted to be more proactive in sharing and raising awareness of vascular EDS because it felt like they were doing something to help. So thank you very much. I just wanted to thank Annabelle's Challenge for their help and all their support in giving this research. And actually, out of this research, a couple of their members went on to do some mental health first aid training so that they could really support those within their community. I'd also like to thank Claire Green, who was my supervisor, and Cardiff University, and thank you to the Ehlers-Danlos Society for having me.